We are going to return to that health alert about that deadly Legionnaires outbreak in Harlem. 2 people have now died and at least 58 others have been diagnosed with the disease throughout the 5 zip codes in Harlem.
We're joined by Dr. Darian Sutton with more on Legionnaires. You know, the health department is examining these cooling centers. What do cooling towers have to do with this problem?
Yeah, well, Legionnaires disease is a bacterial infection most associated with cooling towers, often that haven't been well maintained. That provides opportunity for the bacteria to breed and multiply and then travel via air droplets, which then cause infection. This is not the type of infection that goes from person to person. This is simply directly from exposure to contaminated water sources.
Okay, so if you live in that area,
Yes.
How worried should you be, and what are some of the symptoms that you should be looking out for?
You know, number one, understanding if you're at an increased risk. That includes adults over the age of 65, those living with chronic lung disease like COPD, chronic obstructive pulmonary disease, or those who might be immune compromised. Now, if you are in one of these areas and you have some of these symptoms, fever, cough, chills, shortness of breath, especially in the summer months, that should raise some concern and some suspicion to talk to your provider about getting tested for this diagnosis. It is not as simple as a chest x-ray, although that would likely be involved in the diagnosis.
Interesting.
It usually is tested for, or I test my patients most commonly via urine tests. That's why it's not as easy to understand and track and find.
Do you have to be in an enclosed area to be subject to or vulnerable to this?
You don't. You can be in a hot tub that hasn't been well maintained and be exposed to this bacteria. Just simply inhaling it leads to your risk.
Gotcha.
If it's a windy day,
Yeah.
can those particles then be blown to other parts of the city?
It is possible, but bacteria is still bacteria. The chances of it surviving for long distances are very slim, so these are usually well contained, but they're difficult to source control because mainly it's not from person to person. You're trying to find the point of contact from a water source, which can be relatively difficult. In the city, it's densely populated. There are a tremendous amount of water towers, and many are not kept up to date or well maintained as much as we want them to be.